Hey there, it's Dr. Gress. I want to talk to you real quickly about the elbow joint. This is a little talk that I typically give in my labs because I find that the elbow joint is a complicated joint and sometimes students need a little bit of extra help understanding how all the parts fit together. This might be especially true for you guys now since you don't have those bones in front of you to play with. So the elbow is an interesting and complicated joint. It allows, it's primarily a hinge joint, so it allows flexion of the forearm, flexion of the elbow, and extension of the forearm. Remember that this is the forearm, and anatomically, this is the arm. So in anatomy, when we say arm, we're just talking about the part where the humerus is. So flexion and extension. But it also allows these movements, which are called pronation and supination. Now I don't think you can see my whole self when I'm standing in front of this camera, but remember that in anatomical position, we are standing with our thumbs out to the side. Our arms would be at our sides, but just to show you, your thumb would be pointed laterally like this with your palms facing forward. That's anatomical position. And the position of the forearm in anatomical position is it is supinated. Okay, so let's see if I can point this camera down a little bit to show you a bit better. So anatomical position, my thumbs are pointing laterally, my palms are facing forward. The forearm is supinated in anatomical position. If we flip the hands over so that the palms are pointing backwards and the thumbs are pointing medially, that's no longer anatomical position. We call that pronation of the forearm. So the easy way to remember it is that if your hands are supinated, you can hold sup. Okay, supinated, pronated. Pronated is also the term for lying on your face, and so you can think of palms down as sort of your hands lying on your face. All right, so this supination and pronation is a movement that's happening not in your wrist, not in your hand, but in your forearm. And this is actually a movement of the radius relative to the ulna and the humerus. So this is a movement that in part is happening at the elbow as well. And so the elbow altogether becomes a pretty complicated joint. Let's see, get this back up here. There we go. All right. So I'm going to draw the parts of the elbow joint for you on the board, and I'll show them to you on these bones that I have here in front of me. All right. So let's see. I'm going to draw, first I'm going to draw the humerus. And this would be well, let me see, I have to draw it. I'm really bad with left and right, so hopefully I won't mess this up. This is the medial side of humerus, and that's the important thing. And this is what we call, these bumps just above the elbow are called the medial and lateral epicondyles. Actually, I'm going to be bigger, why not? So the medial epicondyle is a pretty large pointy bump. You should be able to feel that on the inside of your own elbow. Pointy bump there. And then on the outside is another bump that's not as sharp called the lateral epicondyle. So on my humerus here, here's the medial epicondyle, and here is the lateral epicondyle. Okay? And so this is the same as that one, right? So this is the left humerus that I'm drawing up here. In between those two epicondyles, label this here, medial epicondyle, and then this would be the lateral one. In between those two epicondyles, there are what look like three bumps, okay? On the lateral side is sort of a rounded bump, almost like a sphere, and then more medially we have this thing that looks like two separate bumps, but it's actually considered to be one single structure. So our distal humerus looks pretty much like that. If I've done it right, medial epicondyle, this thing with two bumps, and then this one rounded part over here on the lateral side. This rounded part on the lateral side is called the capitulum, which means little head. The word, oops, capit means head, like decapitate. And this structure here on the medial side is called the trochlea. And a trochlea is a spool-shaped structure, like a spool of thread. And there are a few different trochleas in the body. There's a trochlea on top of the talus or ankle bone. There's also a trochlea up in your eye socket. So it's a spool-shaped structure. All right, so we've got the capitulum on the lateral side. Let me just label these medial and lateral, just to make this really clear. Medial is over here on this side. All right, so what bone is going to connect on the lateral side to the capitulum? What bone is on the lateral side of the forearm? Remember anatomical position here. That bone is going to be the radius. And so let me just review now. We've got these labeled. Here we have the medial epicondyle, the trochlea, the spool-shaped structure right here, the capitulum, and the lateral epicondyle. All right, so on the lateral side, we're going to find the radius. So remember, the radius is the thumb side bone, and that's on the lateral side in anatomical position. The radius at its proximal end has this structure that's shaped sort of like a shallow little cup. And then we go down from there. And this is called the head of the radius. Now, in most cases, the heads of bones, like the head of the femur or the head of the humerus, are sort of spherical. In the case of the radius, the head really is actually concave on its proximal end. So it really does look sort of like a little cup, okay? So that's the head of the radius. The joint between the capitulum and the radius is almost like a little ball and socket joint. So here's an articulated elbow right here. And this is the right side one, so don't get confused about that. But here is the radius, the thumb side bone right here. There's that head, there's the capitulum. So in flexion and extension, the head of the radius sort of slides over that round capitulum, but I'll show you this more in a minute, but what happens in pronation and supination is that the radius actually spins, and that being almost a ball and socket joint allows the head of the radius to spin around on the capitulum as well. So that's the head of the radius. And then this bump just below the head of the radius is called the radial tuberosity. So a tuberosity is a big rough bump, and that's where biceps brachii muscle attaches. Sometimes called the bicipital tuberosity for that reason. So that's a muscle attachment. Okay, so that is the radius. Now, of course, what attaches over on the other side is the ulna, and this is a little bit harder to draw from the front. I'll probably make another picture from the side. But this, so remember, this is the trochlea, and so the ulna actually fits onto the trochlea and goes down from there. This is easier if I actually show it to you on the real bone. So here is an ulna. Now, if you're trying to remember to figure out whether you're looking at a radius or an ulna, here's a radius, here's an ulna. You can always think U for ulna. So this is the proximal end of the ulna. The proximal end of the ulna has this U on it, so that makes it pretty easy. And this U is called the trochlear notch. Hopefully you can guess why it's called the trochlear notch. It's called the trochlear notch because it fits onto the trochlea of the humerus. So here again is our humerus, here's our ulna, and the trochlear notch of the ulna fits right onto that trochlea on the distal humerus. This is a pure hinge joint. The ulna only moves in flexion and extension. And it's a really stable joint too. You can see how well that trochlea fits right down into there. On the front, the anterior surface of the proximal ulna at the front of this U, there is a projection going up, and that projection is called the coronoid process of the ulna. So the front of the U of the ulna is called the coronoid process. On the back, and so I'm going to try and draw, hopefully you can see it. I'm going to try and draw this from the side as well. So here's my humerus, medial humerus. There's my, wait a minute. This is my trochlea here. Okay, so this is from the medial side. Here's my ulna. There's my trochlear notch. Okay, there's the coronoid process right there. All right. Behind the U of the ulna is a bump that is called, and I always draw two bumps. This is called the olecranon process of the ulna. Olecranon. The olecranon process is the point on the back of your elbow. So if you elbow somebody and poke them with your elbow, that's your olecranon process. And I always say when these words get long and difficult to remember how to pronounce them, but capitulum, you put the emphasis on that middle or that second syllable, and it's the same for the olecranon process. Olecranon, it's fun to say. So capitulum, olecranon. So the coronoid process on the ulna is anterior, and the olecranon process is posterior on either side of that trochlear notch. The humerus has also two fossas or shallow depressions that these little processes on the ulna fit into. So when we flex our elbow as far as it goes, this coronoid process goes up and fits into this sort of space on the distal anterior humerus that is called the coronoid fossa. And I can bring that up here maybe. Coronoid fossa. So that's a little hollow space on the anterior distal humerus. And I can't really draw it up here anywhere, but if you look at the back of the distal humerus, so this is the posterior distal humerus, there's another hollow space back there, and that's called the olecranon fossa. So the olecranon fossa is back here, and when you extend your elbow all the way, the olecranon process fits into that olecranon fossa on the distal humerus. Okay, so, oops, here is the coronoid fossa on the distal humerus at the front, and here is the olecranon fossa on the distal humerus posteriorly. So this is the olecranon process of the ulna, and you can see when the arm is extended, the forearm is extended, that olecranon process fits right into that olecranon fossa. All right, one more set of structures that fit together that I want to try to draw up here. On the proximal ulna, on the lateral side, there's a little notch right here. Right here. And that is called the radial notch. The reason that this is called the radial notch is because the head of the radius fits right into that little notch on the proximal ulna. So in this ulna right here, okay, there's that U. So this is the trochlear notch. This is the coronoid process. This is the olecranon process back here. So now if you look at it sort of from the front, on the lateral side up here, you can see this smooth notch. And it's got that smooth surface, so you know that's an articular surface. That's where the head of the radius fits. So if I put them together, they fit together just like that. And the reason that the radius, the head of the radius, has this smooth, flat border around it is because not only does the head of the radius spin on the capitulum of the humerus, but also the head of the radius spins in the radial notch of the ulna, like that. So what happens during pronation and supination, right now, so this is a right upper limb, and right now it's in anatomical position. It is supinated with radius lateral, thumb pointing laterally, palm facing forward. So here's the ulna, here's the radius. If you look closely, that elbow should now look familiar to you, okay? And so here you can see the head of the radius is not only on the capitulum of the humerus, but also fits into the radial notch of the ulna right there. In addition to that, and I can't draw this on the board, but on the distal forearm, the head of the ulna, which is right here, has another notch that fits onto the distal radius. So what happens in pronation and supination is that the radius spins, and when it does, the hand goes with it. It crosses over the front of the ulna, and now the palm is facing backwards and the thumb is pointing medially. So that's a motion in the axial plane for the radius. The radius is spinning along its long axis. Only the radius and the hand are moving in this motion in pronation and supination. The ulna does not move. So if you want to verify this for yourself, you can put your fingers on your olecranon process, maybe go down a little bit onto the shaft of your ulna back here on the back of your forearm, and then pronate your hand, pronate your forearm, and you'll feel that your ulna is not moving at all. It's just your radius that's moving in pronation and supination. Okay, so I hope this clears some things up for you as far as the elbow goes. And now when you're looking at your diagrams in your book, which look a lot nicer than this, but hopefully you'll understand a little bit better what all those things are for and how they fit together. Talk to you again soon. Bye.